Hello, my name is Kendrick White. I am an intern in family medicine at Mayheck and Hendersonville in Western North Carolina. I went to UT Dallas from 2010 to 2014. I started out as a neuroscience major and then switched after the first semester to international political economy. Um, so, no minors, no anything extra like that. I would say a typical day for me just really varies. I am currently on pediatrics. I'm just finishing that up. Um, that day typically starts at 8:30 or 6:30 with rounds, where the night team kind of tells us what happened overnight with the patient panel. We divide up the patients. We go and see them, check, review labs, anything like that, and then we make rounds with our faculty, which means we're going literally around to all the rooms and talking about all the patients and with everything that's going on, what changes we're making, how we're managing their care, different things like that. So that's a typical inpatient day in general. And then I have clinic half days where I don't know what's going to walk in. My very first day, I had a 3-day-old, a 91-year-old lady that still thought she was in Venezuela, and then some generic like women's health stuff. And I've seen, all kinds of like stomach pains and headaches, different things like that. So in family medicine, you just get everything, and that's what I enjoy about it. And so I'm about to go on to emergency medicine, so that will have its own challenges and unique fields, but also just useful experiences to have, even if I plan on only doing outpatient. So it kind of all goes into why I went into medicine. Medicine intrigued me in for its problem solving aspects, but also the fact that you're having to work with people. And so that's what first got me intrigued, but it's this whole like why I'm pursuing medicine has been a moving target. It started out with that. While that's so true, much of medicine has turned into very like following the algorithm and following like what we know is best practice through trials and studies, and kind of less problem solving. Some of it's definitely still there depending on the subject matter. But a lot of medicine has been figured out, and so we know what to do when presented with a particular problem. But for me, it turned in, while I was in med school, it turned into more about having those relationships. I was able to do a lot of work at a student-run clinic at UTMB, and I loved it there. I spent so much time there. But it's because I love the patients there. It's an uninsured population, and we were able just to do a lot for them. And as a student, that was like the best place. I really felt a lot of ownership for my patients because I truly knew them better than my faculty, and I was allowed to make calls because of knowing that, knowing their history better, and we just got a lot more decision and ownership in their care. And also at the same time, you feel a lot more responsibility. But I really enjoyed that. And when patients know that they're cared for, they know the difference between going to a doc in a box, kind of run-of-the-mill clinic, in and out type thing, versus like someone's listening to them, someone's caring about them, someone is looking out for them. They know that and feel that, and that's what I like about it. And that's why I picked primary care, because you do have that longitudinal care for patients. Like you can care for them, patients in their when they're kids up until when they grow up and different things like that, depending on where you work, and they see you as like the go-to person. So that's why I picked family medicine. It has a super broad variety. Never get bored. If I do, I can change what I do in terms of like what kind of patients I see, what kind of environment I work in, different things like that. And I actually think I also want to do addiction medicine, which you see a lot of in primary care, and you see a lot of psych. And probably by volume, primary care sees more psych than actual psychiatry because the visits are shorter. So, for better or worse, they end up seeing more patients with depression, anxiety, things like that. And then, question of what is the most important things you did in college that helped me get where I was? I think the important things are stay on top of your classes, and knowing that you want to do this in the long run. That helps out when you're struggling with chemistry, and then the next step is OChem and dealing with that, and then MCAT, which is like a whole new burden, different burden than I had to deal with, even. So I think being able to see the end of the light through all that struggle, and knowing that it doesn't end. Like, I just had to take a 240 question test to see how I would do on my boards just the other day, and I'll do that every year. And then I have to take another test like that for step 3 after already taking step 1 and step 2 in med school. So the whole like big testing never really ends, and you have to be ready for that, and you have to accept that. It's just part of it. I would say also I didn't do anything special as far as like pre-med, honor societies or any like pre-med social groups or anything like that. I didn't do any of that. I did German club and Spanish club and focus because those were those things that I cared more about and I had more of an interest in. And yeah, that's what I did, for better or for worse. So everyone's different. I say pursue what you enjoy, so you can talk about it and have a passion about it. Then that's what's important. Yeah. What resources you use as a student? So I came in, transferred my biology classes, and because of that, and because of my major, I couldn't retake biology, and so it had been 3 years since I took biology before I took my MCAT. So I needed Princeton Review, and that was a fantastic course. It's lots of testing, lots of work, but I wanted to take the MCAT once and be done with it. It got me to a perfectly average score of students that get in. And that, with having good grades, I think helped a lot, as far as getting like my foot in the door in a way. But yeah, that was the only thing I really utilized a whole lot for the MCAT. In fact, that's what I primarily leaned on. Their resources, their books, their tests, and taking the tests, multiple tests, I think is key to build up that stamina of just taking that large of a volume of a test in that kind of setting. I would say, let's see, how did I choose where I applied to med school? So it was probably based on the fact that Texas had a lot of med schools. Texas has the cheapest med schools, and Texas med schools had to take 90% of residents. So I didn't apply anywhere else actually outside of Texas. I just went with that application system, and then that was it. So nothing special. As far as kind of ranking at the end, I got 3 interviews at UTMB, UT Southwestern, and then A&M. And I actually didn't think I wanted to go to UTMB at first, but I realized that they picked me probably more than I picked them, and it turned out to be a great fit for what I wanted, especially with the clinic that was there, like I talked about, and everything. So I think it's one of those things where you end up where you're supposed to be. That being said, takeaways of what you should ask on interviews is how lectures are done, if lectures are mandatory, how much time students have in lecture per day, and how much self-studying time. Our school is very open and very free with our study time during first and second year, to much of maybe their frustration because we didn't attend lecture. It was all posted online. But that meant you got to focus on what you were struggling with and what you felt like you needed to know and what you and study how you want to do, versus sticking with lectures that have way too much detail typically and are not going to be tested on the in the big picture things. Are they important details? Sure, they'll come up at some point, and it's important to know it. But a lot of times, the information is given at such like a subspecialty level for that one topic, and it's not super practical. But that all is very dependent on the subject matter and everything else. But I would say it's important to know the study habits and like lecture demands and things like that for the first 2 years, because that will be half of your med school experience, and that can make or break your experience. Knowing the curriculum well like that is important. Knowing what kind of experience you'll get in your third year is important, and what kind of roles med students have in learning, and like what kind of skills they'll get in terms of actual procedures and different things like that would be good to ask about. Yeah, and just being able to get hands-on experience. Hands-on experience is key in med school. You can read and read and read all day, but you still won't know what things really look like until it shows up at your door or in the ER or wherever. And so that's just key. Experience is key. Let's see, what has been the hardest part of med school? Let's say the hardest part for med school for me was third year, because that's when you're on your rotations. You're basically learning how to do the work of a resident without getting paid. You're paying to be there, and your time is not your own. So you have to show up at 6:30, 5:30 even, depending on the rotation, and you're expected to be there, and you're expected to show up and do work, and be very curious and open to researching and doing extra reading the night after, and staying on top of that and studying for your exams related to those rotations and everything like that. So that's really tough. You really have to like step up your game to that point. But that being said, overall, the first 2 years of med school I thought were going to be harder than they actually were. Not that I had super stellar grades by any means, but overall I thought I was going to be spending a lot more time hating it than I am. I actually enjoyed it a lot. And so far the hardest part of residency is kind of similar. There's just a lot of time. I was just on nights on peds about a week ago, and I put in 78 hours. They limit how many hours you work now, and that's right up there at the limit of 80 hours. So that's tough. And yeah, you just don't get a lot of free time, and you have a lot of work to do. And sometimes you take work home, and that's just the nature of it. Most rewarding part of what I do, kind of already touched on it in terms of the relationship aspect. Having patients that trust you and want to come see you and thank you for what you did for them, and just knowing that they're cared for and that you're looking out for their health and that they're listened to and things like that. For instance, I just saw a patient on Friday for her second prenatal visit. And so she is about 13 weeks pregnant, first baby, kind of nervous, but she was asking like, who's going to do delivery? And it's like, oh, that's going to be me. She's like, okay, good. It's like, because I know you. Like, exactly. Like, I don't care if it's 2 a.m. I'm going to show up. She's like, okay, great. So that gave her a lot of relief. And so that's a special relationship to have with someone like that. So yeah, that's the most rewarding part of the job. It's just being able to relate to the patients like that and get to know them, and for them to know that they are cared for. And then give freshmen who are interested in pursuing medicine, wish I had been given. I would say knowing all your options, kind of know what you want to get out of medicine. It's hard because you don't have to know anything. Lots of people didn't know what they wanted to do until like they're a few months away from applying for what they're going to do for the rest of their life. But if you have an idea and you have strong feelings about that, go ahead and feel that out and look for it and pursue it and shadow and do all that, and figure out all your options to get there. Because you may think you want to do like sports medicine, but then you realize that you actually want to do physical therapy, and that's a whole nother route. They learn a whole nother set of skills. You may learn that, college may be late for you, or you may not want to do the whole like 4 years of med school plus 3 years of residency because you just want to you like the idea of clinic work. And that's fine. I love clinic work. That's what I want to do. But the fact is, PAs do like 80 to 90% of what MDs do. And the schooling's only like 2.5 years. Granted, there's a lot more extracurricular stuff you have to do while in undergrad, extra classes you have to take, and different things like that. And it's becoming probably more competitive than med school in a way because there's fewer slots, at least last time I knew about in Texas. So in that sense, PA school's tougher, but it's like almost a better deal. It's good, like I said, if you want to do clinic work because you can jump into a specialty like cardiology, endocrine, anything like that really, and just kind of jump in and start getting work experience after you graduate. You are trained very similarly as MDs, maybe not as much detail, not as much critical like mechanism of action, biomechanics of what's going on, but you don't really need that, like I said, 90% of the time, because it's, I said way earlier, a lot of medicine is guideline driven and kind of like, oh, we already know the answer to how to address this issue, and we have these steps that follow if that fails, and then you can try this, and then after that, that's when you would refer to a specialist. So with that in mind, like I said, PAs, NPs can do a lot of the same work, and it's kind of a shorter course. So you kind of figure out like how much, things to balance are freedom. PAs are hired. They tend to not be independent. And so that's got to be something you have to weigh out. If you still want to do surgery, yep, med school is pretty much the only way to do that. That's a long road. Talk to people about that, and you need to talk to people that went that route to figure out what they would suggest you to do. But overall, just looking into all your options and thinking about what is it that you want to get out of it? What is kind of like your end game with it? Because the fact is, it's got to be something that lasts for you, something that you have to like hold on to and like be willing to pursue for. At this point, if it is a freshman, you have to be willing to pursue it for 11 years, which sounds crazy, but it's actually not that long. Undergrad flies by. Enjoy it. Don't, as this is more advice, don't try to graduate early. Take your time. Take a semester off. Study abroad for a year. Do that. I wish I would have done that. Take a gap year between med school and undergrad if you can. That would be fun. Go do whatever you want. Don't feel like you have to rush through. I did everything. I did undergrad in 4 years. I did med school in 4 years. Now I'm in residency. And I am not by far the youngest, but I am on the younger side compared to all my peers. So everyone else, kind of took their time. They had other stuff they had to do. Maybe they didn't get in the first time, but they, got to live life in a different way during those times. And not that I feel like I missed out on anything at that point, but if some people are like kind of hedging, should I do this or should I not? Do it. Like, have fun. Do it. You have time to get there. It's fine. The classroom will be waiting. It'll be there. So, yeah, I think that's all I got. If y'all have any specific questions, you can get Katie to contact me, and we'll see what we can do. Bye.